Yes.
Yep.
Okay.
Great.
Hmm. All right. And can you still see it when I put it in that mode?
Even
Yes.
better.
Yeah.
Okay.
Yep.
All right. So in the few minutes that I've got here, I'm just going to walk, many of you are already familiar with this, but I'm going to walk you through just a general overview of registered apprenticeship and how that applies to the community health worker occupation. So thanks again for inviting me, Shandy, and um, just to get us into registered apprenticeship. First and foremost, it's a model. It's a work-based learning model. Um, and it is something that it, from this slide you can see it is industry driven. So industry and employer driven, meaning that uh, the programs are designed with that employer, with that industry in mind. Um, and it's taking, when I say work-based learning model, it is encompassing on-the-job training, so hands-on work experience with continued education. And it's supported. The apprentices are supported throughout that entire process as they go through their program. There are, speaking from that employer lens, there are a number of benefits to the employer, starting with just simply being able to build and shape your own workforce. Um, it's an intentional model. So it is an intentional way of recruiting, developing, and retaining employees. So the the employer has a lot of say in how that happens. Again, it's creating a pathway to employment and a pathway to further development because as they are learning, they are doing the work. So again, they're producing as they're training. And because of that classroom training, they're getting all of the current trend information for that particular trade or occupation, and they're bringing that back to the office or to the clinic. So that improves the productivity not only of the apprentice, but for everybody else as well. It reduces employee turnover. A lot of the feedback that we have gotten directly from apprentices is that they're more committed. They are highly committed because of the investment that the employer is making in their development. So it is retaining that employee and retaining the knowledge. What as we go through that development process, we're capturing best practices and incorporating some new things in and memorializing that. So all of that knowledge stays within the organization. And there are incentives for employers to hire veterans as well. We do have there's funding available. This slide needs to be updated a little bit. We have a new and expansion grant currently that can help with some of the development costs for an a registered apprenticeship program. There's also benefits to the apprentices themselves, as again, they're employed from day one and they're getting that hands-on comprehensive learning. There's safety instruction as well. We want to assure that the apprentices are being trained in a safe fashion. But also, as the apprentice learns more, contributes more, their wages increase likewise. So there's a wage progression that's a part of that. They're mastering those in-demand skills. And a lot of times they're earning a credential while they're in their apprenticeship program, but upon completion of their program, they're also earning a nationally and state recognized credential. And if there are apprentices that have transitioned out of the military, they can utilize their GI benefits for their registered apprenticeship program as well. If some of you are familiar with the Gallup organization, they've done a lot of work on leadership, on development, on engagement. And there was a book, and this was probably late 80s, early 90s, called First Break All the Rules. And out of this book came 12 questions. A lot of times organizations use these 12 questions as an employee satisfaction or engagement survey. And you can see these 12 questions there, and they're grouped into four main categories. And I'm highlighting this to say that apprenticeship speaks to each and every one of these categories in terms of giving employees basic needs of what they need when they are starting their journey in a particular occupation or career pathway. They're understanding who is there to support them along the way. And again, having a mentor that's a part of that, knowing what is expected of them and who's going to help them with those expectations. And also knowing and understanding like what's that next level should they choose to move on to higher more responsibility. It's preparing them for that next level as well. This information is coming from the U.S. Department of Labor, and there is a proven track record in terms of return on investment. There's a $1.47 return on every dollar spent on apprenticeship by employers. So there is proof that this really does add additional benefit to the employers. Just quickly, for those of you that are new to this, there are a few components to registered apprenticeship, to that model. Again, it starts with employment. So from day one, that apprentice is employed. And from a labor standards perspective, we look to see that the apprentice is classified as full-time and that they're benefit eligible. So that's kind of where it begins. From there, there's three separate categories of training. Again, that on-the-job training, the day-to-day responsibilities of that particular occupation. It is occupation specific. So in this case, we're talking about the community health worker role. For a program to even be deemed apprenticeable, there has to be at least 2,000 hours, roughly a year in length of that program. Uh, Again, it's occupation specific, so depending on the complexities of the program, there could be a program could be 1, 3, or even 4 years long. The community health worker program is a year-long program. And again, with that on-the-job training, the apprentices are paired with a mentor. So we call it a journey worker. Uh, Again, you could think of it as a mentor. It's somebody that has that subject matter expertise that can provide that feedback and insight and support to the apprentice as they're going through their program. The second category of training is related instruction. That's the classroom training. In many cases, especially for the community health worker program, a lot of that classroom training is coming from the Community Health Worker Certificate Program. However, on the job, there might be some additional training that the employer wants to provide for those apprentices as well. And the third category of training is safety. This is really something that you're probably already doing. It's looking at topics like things that you would find in the new hire orientation, employee harassment prevention, violence prevention, sexual harassment prevention, first aid CPR, emergency preparedness. So there's a lot of things that you're probably already doing that can be allocated towards this towards the safety training. The next component again is that progressive wage schedule. As the apprentice is going through their program, their salary increases likewise. And again, upon completion, they earn that credential. When we're working with new employers, the development process is pretty streamlined. It's already an existing program, so we already have kind of the template for it. So what we would do is look at the job description and see how that aligns with the existing template for the community health worker. And then from there, we just have a series of meetings to outline those components that I just walked through. So capturing that information. And what we're capturing that information into is the apprenticeship standard. That's the formal document that outlines the program. Once that program is approved, we look to see that the first apprentice is registered or starts their program within 30 days of that approval. And then we have some regularly scheduled check-ins in the beginning, especially 3 and 7 months. And then from there, it's an annual review. And, when we're going through this process, the Apprenticeship Minnesota, me in particular, I'm partnering with you. So it's not like I'm handing you the standard and you're filling out all of the information. I'm really walking with you and helping you as we go through every step in that process. Um, there's a couple of different ways that this can work, though, too. There's different options. So you as an employer can have your own program, or you can be a signatory employer to the Community Health Worker Alliance. So there's a couple of different options there. Um, and just briefly, and if anybody's interested in this after this, I'm always available to talk through this. The sponsor of the program is the entity that owns and is responsible for the program. That can be, in this case, it could be the alliance, and or it could also be just a single employer that's also the sponsor. Um, but this slide kind of highlights the responsibilities of the sponsor, and in the event that if an employer is joining the alliance, they would then be the signatory employer. So the alliance would still be responsible, own the program, but the signatory employer is who's hiring the apprentices. Okay. There's still some skin in the game for the employer, right? So there's still some responsibilities there, but uh, if the option is to join the alliance, then the alliance is your partner in helping to support through that process. If there is an interest in joining the alliance, I just put this slide in here too, that again, the the in this case, the alliance is considered a multi-employer sponsor, right? So they have those signatory employers that are signing up with them, and it's really just helps the employer um, in terms of just having those additional resources and support of carrying out that program. And again, anybody interested in that, uh, I can certainly speak more with along with Shandy with anybody that's interested in that. This slide just wanted to give a quick synopsis of the different industries that we have registered apprenticeship programs in. Of course, it started in the construction and building trade, so they have the bulk of the programs along with the utilities, but um, manufacturing, healthcare, public sector especially too is quickly on the rise as well. This slide here. I just wanted to highlight that there are on the right-hand side there, the other occupations, we have many different programs within the healthcare sector. Okay. I'll just wanted to highlight these are some of the sponsors that we have in advanced manufacturing and some sample of some of the sponsors that we have in other program areas as well. And that's it. So if you if you have any questions, again, I'd be happy to answer any questions as we get to the end.
Thank you so much, Leslie, for that wonderful presentation. I know it's a lot to chunk down and a lot of information, but I think you did a really good job doing an overview of that. If you can put your email into the chat, just in case folks want to pick it up from there, I will also share it out after our meeting as well in the meeting minutes or meeting notes that go out with the recording. I yeah, I'd like to kind of continue on with what Leslie mentioned about the sponsorship and the fact that um the Alliance, yeah, became a sponsor as of May of this year, which really came about through conversations with employers like yourselves and supervisors who were mentioning to us that the difficulty kind of lied with the creation of related instructions, which was specifically safety trainings. And that was something that as a sponsor, we are able to then provide in as part of meeting the requirements for the apprenticeship. And that's where a lot of employers were kind of struggling with, other than some of the other looking into cost benefits of an apprenticeship program, which, as Leslie mentioned, there is proven results of not only for the costs, the added value for employers, but also the value that you have with CHWs who are going to be very well trained, as well as ready to be upskilled in their work and continue on, hopefully remaining and retaining your employee. Thank you so much, Leslie. And the next person I'd like to hand it over to would be Vanessa Southworth. Um, I'm blanking, Vanessa, on your title. I believe it's Director of Community Wellbeing.
Yes.
And you're going to be speaking about the fact that Winona Health is an apprenticeship site itself. So technically it's own sponsor of your own apprenticeship program. So go ahead and take it away.
Yeah, thanks, Shandy, and thanks for that great information, Leslie. So I'm just going to share a little bit about our program, our community health worker program. As Shandy said, I'm with Winona Health, and Winona Health is a rural hospital and clinic, and we're located in the southeastern part of the state in Winona, Minnesota. And our program roots kind of go back to 2016. The idea started with the community health needs assessment process at that time that brought forth urgent needs around food insecurity for the residents in Winona County. And so Um, our program really began as an idea about how to address food insecurity in the county, and the group of people that were working on that came across the Pathways Community Hub Institute model of community-based care coordination, which of course utilizes community health workers, and that's the model that they landed on and then finally implemented in mid 2019. So at the time that we started, we were really focusing on food insecurity, but then of course, the COVID-19 pandemic came about, and we quickly realized that we needed to, or we had an opportunity to help address some of the needs that came up with that. With stay-at-home orders and everything shutting down, we expanded our referral criteria to include housing insecurity, eventually added mental health challenges. Then sometime later, we added emergency or frequent emergency department utilization. And then most recently added serving seniors 65 plus with health-related social needs. So we have a relatively broad scope in terms of the folks that we serve in our community. That said, we do only serve Winona County at this time. So residents of Winona County. And we utilize the community health workers then to really connect with people that have health-related social needs or social determinants of health needs and provide health education to them and then help connect them to resources and services in the community to meet those needs. Referrals to our program can really come from anywhere. And so we try to have a kind of all doors work to get referrals to us. And I'm just kind of going through my list here of things to make sure that I'm providing the background. We collaborate not only with providers internally to Winona Health, but also, folks across the community with a variety of different service providers. Recently, our program has undergone quite a bit of change. We started out as being a hub, meaning that we contracted with various providers in the community to house community health workers to do the care coordination services. And now we've kind of pivoted to being focused on doing everything within Winona Health. So through some of those changes, I'm now the community health worker supervisor. And a little bit of the reason why I share that is because the person who originally set up our apprenticeship program is no longer with Winona Health. And so I've kind of stepped in after all of that was set up and established. So I wasn't directly involved at the time that we started our apprenticeship program back in October of 2023. But all of the feedback that I've heard is that it was a very supportive process working with Leslie and getting that all set up. And I know that we have encouraged other organizations to become apprenticeship sites if that's something that they're interested in. So far, I think that we're the only one, right in our area that I'm aware of, and Leslie could tell me if that's wrong. But we really got on board with the idea of doing this because we have wanted this to be another opportunity to help with recruitment and retention of community health workers. And again, our program has undergone quite a few changes recently with funding changes, staff moves, and different things. But ultimately, being part of this apprenticeship program is something that we're committed to and think that it's really a good place for us to be in the long run because it can be challenging to recruit community health workers in our area. We don't have as many in our area. I currently have a position posted, and while there are people interested in the work, it's very uncommon for us to get an applicant that actually has a CHW certificate or has already received the training. So this is something that we want to continue to be involved in with the apprenticeship program. So in terms of the training that we provide as an organization, as I mentioned, we are a Pathways Community Hub Institute program. And so we follow that evidence-based model. And so when we onboard staff, we're required to send, or we provide, I'm actually a model trainer. So I'm able to provide the training specific to the model for community health workers in our program. And then I think all but one community health worker that we've ever hired has not had the CHW certificate. So they will also be going through a certificate program in the state of Minnesota. Let me see what else is on my list here. In terms of the impact and value of the CHW role at Winona Health and in our community, I think that considering the broad referral criteria that we have, really some of the things that we are looking at as positive outcomes are that reduced emergency department utilization, and seeing an increased connection with a medical home or primary care. So kind of shifting costs, if you will, from emergency department utilization to primary care utilization, and having folks connected with those services and resources needed to meet their basic needs to then improve their overall health and well-being. So I'll kind of stop there and see if there are any questions about what we're doing.
Uh, this is Miriam, the next speaker. Vanessa, I'm just not gonna say anything anymore. You just said it all so well. I
Oh,
love it,
goodness.
Vanessa. Because it's exactly the pathways that we need to continue making, and not everything is written now with the help of Chandy and Leslie. I feel that we have a stronger view of what's next, because in a way you created a pathway. You use a institutional program model to help you get where you are. But you're right, there are not enough certifications out there. So now the thing is the help with Leslie and Chandy to say, okay, let's make it worth it. So my question is, how long have you been doing this? I mean, you mentioned that you weren't there in the beginning, but how long has it been?
Well, we've been an apprenticeship site for almost 2 years, but we have been implementing our community health worker program for 6 years.
6 years, okay.
And we have had, oh, go ahead.
Oh, no, go ahead, Vanessa. I had a follow-up question after you're done.
I was just going to say, we have had, this has not been a linear progression for us. We have had a lot of hills and valleys with implementation of our program. At two different points, we have successfully grown our program out to, for us, the largest in terms of our team has been that we've had 5 community health workers, and we've gotten to that, and then we've been poised for growth, and then stuff starts to happen and people leave for various reasons. And so now, if you would have asked me, 6 months ago, we were poised at that growth space, and now we're kind of back in this rebuilding space again. So it's kind of been like this, and I don't think that we're unique in that, but it can be hard to think you're gonna grow and then suddenly you're shrinking and just trying to rebuild again. Yeah, that's just what I'll say about that.
Vanessa, I have one more question for you before we move on to the next speaker. But if folks have more questions for Leslie, for Vanessa, and then for Miriam, please put it in the chat, or we can try to get to them at the end too. My question for you, Vanessa, would be around significantly what we've found as the Alliance has talked to employers about apprenticeship model has been around the trainings, and like really seeing the value of like the upfront costs is really what oftentimes employers are seeing. But what do you feel like as you witnessed the program in the last 2 years? where is I guess my question is multi-part, but it's talking about, can you talk a little bit more about the maybe some of the challenges when you first started, but also what were the value adds of having apprentices at Winona Health?
Yeah, I mean, I think that again, I wasn't as directly involved right from the beginning, but the feedback that I heard from my former colleague was that because we already do so much training and, between the training that we're required to do for our Pathways Community Hub Institute model, and then
Mhm.
just things that we need to do internally as being part of a hospital system, it wasn't much of an extra lift for us to get all of the trainings completed.
Okay.
So for us, I think that worked well. I think I'm veering off from your question a little bit, but I think
Oh,
the
that's all right.
Minshua being able to help other employers get into the apprenticeship, I think is really key because I recognize that not everyone has access to all of the training resources that we might have being part of a hospital system. So I think that that's huge. I think for us having, just another structure within which to have growth for a community health worker has been positive because, certainly there are various structures we're operating within for our evidence-based training and that, but just to be able to have the phases of, what needs to happen during this time frame and what needs to happen during that time frame. Having the wage change, I think that there's something in there for an applicant coming in, knowing this is what's going to happen as I progress forward in my growth in this role. I think that that's a real positive. And so again, I really think that being in the start, I mean, this is a looking forward that I'm hoping this will continue to help with recruitment and retention as we move forward too, because with more CHW candidates coming out of certificate programs, if we could potentially get interest from, other places, if there are people looking for apprenticeship sites. And so I think it's just nice to have that option.
Wonderful. Thank you, Vanessa. Thank you for
Yeah,
being
thanks
on
so
and
much.
being willing to share your story about Winona Health as an apprenticeship site. I'm going to hand it off to Miriam Goodson, Executive Director with ACLA. She's going to talk a little bit more about what ACLA is, kind of joining our community here at SRT, and then talking a little bit more about the signatory employer experience. Miriam is actually, and ACLA is actually a very new organization to our sponsorship. As a sponsor, we are responsible for a CHW apprenticeship program similar to Winona Health. And the signatory employer falls under our sponsorship. So we're kind of in tandem, like Leslie mentioned, where we're working very closely to make sure that the requirements are met, but then there is support as well and partnership. So with that, I'm going to pass it on to Miriam.
Thank you, Shandy, and thank you everybody for giving me the time to explain a little bit what ACLA is first, because it's a diverse group of Alliance of Chicanos, Hispanics, and Latin Americans. So I'm gonna go and share. Let me know if you can see it. Yes. All right. So it's a grassroots organization, and it's truly the name is because we are very diverse, and a lot of people do not understand that even if we speak the same language, we don't have the same sayings, the same technical background. A lot of things are different. The food is obviously very different from each country. So the variety is also those barriers that we encounter, but all are similar to how we can bring support to everybody. So that's the trick right now. So coming into the apprenticeship program is because I'm gonna go ahead and do the next. Oh, it's not moving. So I need to go back to the other, up there. We were founded in 2004. We've been empowering the Latino community, trying to bring diversity and the contributions that the Latino community does to be upfront to the community. If we bridge again, this has been since 2004, and we've been part of different programs. We have created different avenues and bridges to reach out to the community and to connect our community to the larger community. Just last year, 2024, we had a lot of connections. We serve families with housing, with the direct educational tutoring. We help with transportation. Right now, we have driver license for all that has helped the transportation issues that a lot of people didn't have a driver license. But still, if we talk about the environment, we want more people to be using bicycles, and the transportation in the city of Rochester downtown is impossible. So you're better off on a bike getting to work because there's not that much parking and there's a lot of construction. So, and then last year we had 2,500 participants at the Latino Fest. This year we raised 3,900. So 4,000 people were here a couple of weeks ago in the Peace Plaza. So our outreach is growing and is more impactful. We do a lot of the civic engagement. So that is with immigration help and immigration legal support and knowing your rights and things like that the Hispanic community is going. And in those events, normally we have this outreach, trying to get people to sign up for initiatives that we're growing. And the community health worker is one of them. The apprenticeship program, overall, focusing on the workforce development. This is in my speech for a press conference that we have with about 10 Latino-led organizations in the cities. We are the only one in the Southeast. But this is exactly what we're working on, that remove barriers for Latino professionals to access licensing and certifications. You name it. We're going to work with the adult diploma, with adult literacy, with medical fields. Here is very strong. The healthcare and mental health access is very important in the rural area. It's bringing the Minnesota into the news. We just had a series of NPR talking about the crisis that we're going through. So we really have to get navigators, diverse workforce development navigators. In this case, it's community health workers. We don't have enough. So, and truly, I want our Hispanic community to be contributors of this community, to be noticed, to be certified. So that's why the effort towards the apprenticeship program is going to be essential, because we are a small nonprofit organization. These are the partnerships and collaborations that right now we're kind of strongly tied with. The one that you see here, RHCP, Rochester Healthy Communities Partnership, we've been in existence for 20 years. And this lady has been advocating for the position of community health workers. Back then, I would say navigators. So I would go with the National Institute of Health in front of all the directors and say, guys, you're not paying us enough when we're doing the work of bilingual specialists or bilingual interpreters, navigators, helping the social workers, the doctors, the nurses. I mean, we were in the middle. So advocating for that position and to become well paid, it was a struggle. But the Rochester Healthy Communities Partnership, I'm bringing it up because we are partners in research using community-based participatory research. It's a platform, it's a model to advance what Vanessa was talking, a pathway that institutes recognize and are using best practices. So we know that we are slow in developing enough community health workers. Well, we started developing health promoters. From the health promoters, we trained 46 health promoters, and now we're moving into who wants to become a community health worker. So all of a sudden, we build a platform, and then we're going to offer the community health worker certification. Because here, there is funding. Mayo Clinic needs community health workers. And we know because other partners, others people are getting there to where it's a paid position, a well-paid position, and very appreciated. So just moving on to the next thing. This is part of what we're doing. Well, we don't have that much funding to do the unrestricted work. So we want everybody to donate to our cause. And we do different things, but also is just a way to tell you we are not just relying on state funding. We're not just relying on Mayo Clinic funding. We need to bring the community together because the problem is bigger than we can handle. We are just at the tip of the iceberg with all the things of healthcare access, and so we need to work together. So joining Shandy and Leslie and all of you, I feel like we're gonna do well. Any questions? Because I took more time than I should. Sorry.
No, it's okay. I always give more time than less, actually, so no worries. If anyone has any questions, feel free to get on mic or put your question in the chat. But I do have one question for you, Miriam. I'm wanting to know, so it took about a year. I think it was a year process, not because, you didn't want to be an apprenticeship site. It was because the barriers were right there, right? You were dealing with, for your organization, there were significant things that maybe weren't at the time something that you could do, being an apprenticeship site. So I'm curious, from the first conversation, I think would have been last year with ACLA to I feel like this past summer, actually, we've signed you up as a signatory employer. What changed in that time period? And why ultimately did you decide to become a signatory employer?
Yeah. Again, we are a small organization, and I am so lucky to have a project manager that knows what she's doing in a way of eliminating barriers to the communication that exists on the getting into the the technical college that offers the classes for community health workers. We're technologically I don't know how to say it, handicapped, because sometimes it's the opportunity is that somebody needs to be technologically savvy, knowing about processes, and it's probably was one of the things that somebody was mentioning. You are helping us with the process. If somebody doesn't help us with the process, for us it's a model that won't work, because we want somebody to be able to create the pathway to training, the pathway to stick with it. Because sometimes, again, a small organization, we're spreading thin. We want to grow the area of health, but there are a lot of technicalities that sometimes I do not know if everybody has the same set of skills. So we are complementing each other, and that's what I feel, that you are complementing us on the things that we lack.
I love that. That's so well put, Miriam. Thank you so much. Any last thoughts that you have that you want to share about being a signatory employer or um, yeah. Okay. Well, I am going to move on to the next thing on our agenda, which is to go over sort of a round robin and learn about what resources or information that folks want to share out. You don't have to if you don't want to. But yeah, feel free to give an update. And I actually before I began with the round robin, I had one thing I wanted to add to what you said, Miriam, was really, you came with a really lot of like positivity, and I felt that energy. Thank you so much for kind of bringing that into the space. I think we need to be reminded, especially when it feels like a lot of change ups not for the better have been taking place and affecting a lot of our organizations. So thank you so much for naming that together we are so much stronger. And speaking to that is there are some other folks who are either like Elder Circle. Congratulations as you are considering and on the process of being an apprenticeship site yourself, that we are needing to maintain that connection and that community. And so the Alliance does have community of practice for apprenticeship sites and for apprentices, whether they're under our sponsorship, we do actually connect with other apprenticeship sites. So that's something that is of interest to folks who are going in this pathway. Just know that there is support for you, no matter whether you're your own site or under as a signatory employer. So just connect with me if that's something that would be of interest to you. Okay, so I'm actually going to thank you, Tuesday. I see that you're jumping off early. Thank you so much. I'm going to go ahead and just pass it off if anybody wants to take it away with an update for our group. Anything coming up? See if there are questions.
Hi, this is Renee from Elder Circle.
Hey, Renee.
Hi, yeah. So we've kind of gotten our semi-official that we're an apprenticeship now. We went through the process with Leslie, and as somebody else had mentioned before, she was extremely helpful. So it's not a difficult process. If you were left to fend by yourself, it might be, but she's very helpful. And then something else too about talking about not having, I think it was Miriam who said something about not having maybe all of that training availability. I know for us, we are a smaller nonprofit community-based organization in a very rural community in Minnesota. But we've partnered a lot with our healthcare systems in the area. So some of our trainings are actually partnering with them and utilizing them to offer some of that training for our CHWs. So through their healthcare system, our CHWs would attend with their staff in some of the trainings. So looking for some additional resources out there if you don't have the resources yourself for some of those trainings. I think is looking towards healthcare systems as it was talked about with Winona Health too, having availability to all of that. So that partnership for us has worked really well in our community.
Thank you, Renee. I appreciate that plug. That's super helpful. Okay. Any other updates or? Very quiet group today. It's okay. And it doesn't even have to be topic specific, honestly. So. Oh, I see in the chat, Renee. Yep. Miriam would like to exchange numbers. That's great. Making those connections.
I just want to tell you that I had a meeting on Friday with United Way, United Way of Homestead County that is in different counties around the rural area. And they mention it. They want more community health workers and navigators in the diverse workforce. But it's if you're competing with high paying jobs, a lot of people go into nursing or they go to another of the high demand jobs that are happening. But what we have in our favor is that RCTC and all the universities only can produce an amount set of trained individuals and their admission capacity is also limited. The community health worker right now, it's not accessible at our technical college. It's called Rochester Community Technical College. There is not a cohort, like the demand is not organized. So probably later it's gonna get organized. So they recognize the need of training community health workers in the hometown because online is one of the barriers that I was telling you. I encountered that not everybody has access online and is able to do the cohorts online. It's better in person. So
yeah, we in Winona, we also don't have an in-person option close to us. And so certainly we've seen that for some people the online can be really challenging. And so I don't know if that is something that will be changing or not, but I would love to see an in-person option if it could be available.
I'm curious, Mary, are you in conversation with Rochester School?
yeah, I do have my informants, I would say.
Okay, I might want to
So
get in touch with you on that because I think that's something that, the Alliance is always trying to see how we can work better with the schools and ultimately get more students enrolled. Yeah, absolutely.
Well, but this is from a community health worker that got trained there were two cohorts here in Rochester that were in that pathway. They get paid better at the school district. So they say, why would I move with my community health worker certification if they're not going to acknowledge it in all the areas? So she preferred to continue being a bilingual specialist for the school district. Again, the value of the language is still not factored into the system and the relationships, the trust, a lot of things that are happening with a diverse workforce.
Yeah. I mean, I think that like Miriam and Vanessa, you brought this up, and I'm sure others on the call probably would resonate with what you're saying about like it just feels like there's a cap on how many CHWs maybe get through the certificate program each year or how many go in to get enrolled. And that kind of, that can create a barrier to recruitment. It can create a barrier to increasing your CHW team, right? And that some of the things that you kind of alluded to, Miriam, are like the fact that wages matter. Like people will go through the certificate program, but if there aren't available jobs at the time that they're looking, they're going to look elsewhere, right? If they're at the time they're looking, there might be a CHW position, but they get paid, that maybe that CHW starting wage is less than another job that they could be making more at. The sacrifice that they're going to make is they're going to choose this a higher paying job, right? So there's definitely a lot of nuances because we are seeing more graduates come out of, as folks have been attending SRT, you probably heard the updates from MDH. We have CHWs graduating through our programs because they're receiving that scholarship. And even as we know, some of that the scholarship money is kind of going away. That's going to, again, create another thing that we have to address. That was like, I think over 260 students went through the certificate program. That's a tremendous number. I mean, that does say, even not including the years before, right? Previously, where there are CHWs across the state. I think we're at over 800 at this point. So there's got to be something there. There is something to the wages, the lack of really respect for the profession itself. And so yeah, that's kind of what I'm hearing, Miriam. I don't know if that's what you're kind of speaking to, but that's what I'm hearing from you, Vanessa, as well, with the recruitment being difficult, certainly.
Is anybody currently billing for CHW work?
Yes, we are at
You are.
Roundtable.
Okay. And do you find that the reimbursable rate, because if I'm correct, is that at $44 an hour, or was that what it was?
So we don't bill to straight MA.
Okay.
We have contracts with two different payers, and so we contract for a different rate with them.
Okay.
This also has to do, without getting too far into the weeds, because of the model that we use. We bill based on outcomes, and so there's a certain value attached to each type of outcome that we're working. So we'll get paid different for securing housing for someone than for doing health education. So one of the things on my plate is to figure out how to bill straight MA. We just have not done it in our program.
Okay. Yeah, because that's kind of, as like I said, a smaller nonprofit, we are looking at ways to bill and secure that in along with we do bill already for multiple different things. We do not bill Medicare and Medicaid yet at this time, but we do build waiver services. And I was just curious how people were finding, because it does feel like in some ways that the value that has been put on that billable rate isn't as high, but that's kind of the same way, and I get off my soapbox about this, but the whole reimbursable rate on elderly waiver and all of that is so low that in order to pay your CHW a livable rate, it can be challenging. Now, we were lucky enough to send two staff who are existing staffs who are our home visitors who are already doing basically the work a CHW does. This made like complete sense, and our goal would be to have two or three more attend college in the fall of 2026. And then we also do caregiver consulting. So our CHWs are not only a CHW trained, they're caregiver consultants and certified dementia practitioners. So it gives us a little bit more of a revenue source. And I know it doesn't always come down to that, but in order to be sustainable and to be able to do a great wage that would keep people on staff, we had to look at different ways to do that too.
Mm-hmm. No, I love that you're naming that too, Renee, because that's, yeah, don't have to tell. It's kind of like everyone here on the call definitely resonates with that, what you're saying. Um, I feel like there's ongoing work around that, and I hope to have more updates in the next year, and that maybe the creation, kind of bringing back the legislative action group would be really is something that we are thinking about doing. Certainly moving more policy is something that the Alliance has in mind as well. Um, but yeah, there is definitely just disgruntled, sighs and frustration all around with that, on the topic of that. Um, but there's opportunity as well. So I know that there are groups that are meeting and continuing to provide feedback. I think MDH had an advisory committee sort of weighing in, or was asked to weigh in on current standings with billing and yeah. And so there are ways that maybe we can get more involved or keep folks abreast of information. So if I see anything, I will maybe try to pass that along to this group. So that's good to know. In the last 15 minutes, unless anyone has some other pressing things they want to bring up too, feel free or put in the chat. I'm gonna move on to end of year survey. It's a quick, I try to make it very easy. It's a very quick, I want to say like 2-minute question or survey. And I would like folks to do it now. So that way we like you check that off your list. It's like during this meeting. So it's so much easier. I don't want to have to take up time later. And then the next thing I also have is a statewide survey. So in the Alliance has been working with MDH, as we know, and one of the key goals for the sort of CHW roadmap and sustainability, as we're talking, we've been talking here shortly about we want to continue to expand and grow the profession, is looking at collecting data. So we definitely need to hear from our employers and supervisors. So if you are a supervisor or an employer of CHWs, please take the time to take the survey as well. You don't have to do it during this time, but I am also just giving you this time anyways, so you might as well, you could if you wanted. So let me put that, I'm actually gonna, hold on a minute, I'm gonna try to copy it and put it in the chat as well as, sorry, actually, let me just put the end of the survey, so the survey for the supervisory roundtable, I'm actually going to link that first so I don't confuse folks. And I'm hoping that it opens for folks. This is the first time I've used this form, so let me know if you can't get in. Yes, and that's just like a 2-minute-ish survey. If you can do it, that'd be great. And let me get this statewide survey as well. We're hoping to hear, for the statewide survey, we're hoping to hear from as many folks as we can before the end of October. So doing it now, you can kind of check that off your list, but I also will email it out to this group and to everybody on the listserv to fill it out as well.
Jandy, I know that this is silly, but I haven't attended all of them, and I don't remember which ones I have attended.
Oh,
so
yeah, I should have done like not applicable, or I don't think I did any of that. What would I have you do then? Then just go ahead and just check this one because you did attend this one. So they're
Okay.
anonymous. I might know that it's you if it's just that one, but no judgment here. I really need truth and honesty with the surveys, but they are anonymous, so feel free to, yeah. So if honestly, Miriam, just check the box for this session. It's okay. Answer what you can. I know that the questions are required though. I'm glad we're doing now because then people can ask questions. No worries.